Assalamu alaikum. This is me, Dr. Jahangir, and you are watching me on my YouTube channel, that is Dr. Jahangir Khan. Today we are going to discuss another very important chest X-ray. You can see over here. This is actually a case of this was a case of a barium swallow. So you can see the trachea. You can see the trachea has taken up the contrast. The trachea has taken up the contrast, while ideally in barium swallow or barium follow through, the contrast should only go to the esophagus or the stomach, but not in the trachea. So in the barium swallow, if the trachea is taking up the contrast, what are the two possibilities? One is the tracheo-esophageal fistula, and the other is aspiration. So in this case, if you focus over here, there is construction of the esophagus. So there is construction. So that was actually the area where the mass was suspected, and actually from there the patient aspirated. Over here the patient aspirated. If that was the tracheo-esophageal fistula, then there should be communication directly from esophagus to the trachea. Then there would be, if there was a fistula, then there would be a contrast pattern like this. There will be no contrast upside, but in this case you can see the contrast is going superiorly. When bronchoscopy was done, that was normal. The trachea was normal, the right bronchus and the left bronchus was normal. So while the endoscopy that was done, that shows a circumferential thickening in the upper portion of the esophagus. So this was a case of esophageal CA leading to dysphagia, and upon barium swallow, the patient aspirated. Some of the barium has gone to the trachea, and some of it is gone to the esophagus and down to the stomach. So thanks for watching, and please do subscribe my channel.